So a 40-year-old woman comes to my clinic and she has complaints of very heavy and painful periods. She has loads of questions. Why is this happening now? What is wrong with me? These are honest questions that you really want your doctor to answer. So in this video, I'll be talking about fibroid. I'd like you to listen to the end, leave your questions and comments below. And if you have loved ones or friends who you think would benefit from this topic, please feel free to share it. So what is fibroid? Fibroid is a benign muscular tumor that grows within the uterus of women. It is not a cancer. It is not a cystic growth that could burst or you drain the cyst and it's gone. It is muscular and it grows within the uterus. It could grow within the cavity or it could grow within the muscle itself of the uterus. The cause of fibroid is not known, but over the years, studies and from presentation, fibroid has been known to be amongst a particular people. For example, fibroid is known to affect some families more than others. So you will see someone says, oh, my mother suffered fibroid, my sister suffered fibroid, my auntie suffered fibroid. So it runs in families. Fibroid is also known to affect the reproductive age group. So you get the presentation from the ages of about 16 through to the age of 50. You know, that's when you begin to hear of this problem. We also know that fibroid affects a particular ethnic group. It affects the Afro-Caribbean women more than the Caucasian women. We know as well that recent studies have shown that women who have low levels of vitamin D tend to suffer fibroid more. So are there protective factors? What is it that can protect you, can protect me from having it? Okay, the cause we don't know, but like I said earlier on, low levels of vitamin D, you know, such people are prone to fibroid. And therefore, if we have a high level, sustained high level of vitamin D, that is a protective factor. Another protective factor is use of the birth control pill. So women who have been on the birth control pill, over time, research has shown that such women do not often present with fibroid. Pregnancy is another protective factor. Pregnancy here is a very tricky one because in some cases pregnancy could cause the others, could make the opposite. But having your children in your early reproductive age is a protective factor against fibroid. Talking about the symptoms of fibroid, it's a bit extensive. I'm going to try to cut this as much as I can to make it simple. Some people could have fibroid and have no symptoms at all, okay? You could just find it on incidental finding. You did a scan for something else and they say to you, oh, you have a fibroid, right? So these are the lucky few. Most women would present with symptoms depending on where the fibroid is or what type of fibroid it is. Remember I said to you that a fibroid could be within the uterine cavity and sometimes it could be within the uterine muscle. So what this means is a woman could present with very heavy periods, right? This is especially those women who have it within the muscle of the uterus. And so what happens during periods is the uterus contracts, and that's when you get the cramps. So when the uterus contracts, it expels blood out. Now, if there is a tumor within the muscle of the uterus, when it contracts, it's not able to contract freely because there's something in there. If I have this tissue in my hand, it's not going to fold as much as my hand would fold if this tissue wasn't in there, okay? So that's what happens. So the uterus is not contracting properly, right? And so the blood is oozing out. So that explains heavy period and painful period. Some other women might present with infertility. This would be women who have it within the uterine cavity. Okay, so if there is a tumor lying within the uterine cavity and conception takes place and the baby needs a place to implant within the uterine cavity, if the fibroid is there, that will not be a conducive place, and so that leads to infertility. You lose such a pregnancy. So we've talked about heavy period, we've talked of infertility and the reasons why. Some people would have bladder dysfunction, so you're having either frequency, you're having to pee quite often. Again, given the position of the uterus, if it's pressing on the bladder, which is right in front of the uterus, then that would irritate the bladder quite often and make you pee. Another presentation is that of painful intercourse. This also talks about the position. If it's lying so low, so the uterus is very low and pushing down within the vaginal cavity. So if I quickly go through heavy period, infertility, heavy painful sexual intercourse, bladder dysfunction. So these are a few things that we would have with fibroid. And like I said, don't forget, some people would have no symptoms at all. Somebody asked me, can you have more than one fibroid within the uterus? The answer is yes. In treating fibroid, we are mainly interested in the patient. Are these severe symptoms? Is it affecting fertility? Is it just a minor symptom? Can you live with this symptom? So these are the questions that we've got to explore before we think of managing. If it's just heavy periods that someone is having, then yeah, someone could just treat the heavy period and leave it that way. That brings me to the mode of treatment. We have oral medicines to treat it, some like treating the heavy periods. We have other options like shrinking the periods, shrinking the fibroid, and we have surgical mode of treatment, which could either be removing the fibroid itself or removing the uterus on the whole uterine cavity, the whole uterus on its own. So when I say it depends on the patient, so a patient could come to you, has lost so much blood, has had to have blood transfusion or iron infusion because of this heavy period. Such a woman, and then you look at such a person, she's had all her children, she's not looking to have any more children. Such a person, you want to offer either a surgical option, so to go in to remove the entire uterus. Such a person might say, yes, I want that. Or you have a lady who is still maybe 32 years old, has been trying to have babies and cannot have babies because of fibroid. That is a candidate we would want to go in and remove the fibroid on its own. Just get it out, so that the uterine cavity will be, much more conducive for a baby to implant. Or you have someone who says to you, I don't want to remove my uterus for such and such reason, but this fibroid, the symptoms are really severe. I mean, that person, you could give treatments that would shrink the size of the uterus. Most times, if we could live with the symptoms and it's not bothersome to our health, then we know that once one gets towards menopause, that uterus, the fibroid size begins to shrink. We know that a fibroid is mostly associated with the estrogen hormones, and so as these hormones go up in the reproductive age group, we're more prone to it, and when as it goes down from the menopausal age, it then shrinks. So there is a time for everything, and so if these symptoms are not bothersome, then we know that over time it's going to shrink on its own anyway.